This is Late Night Health, the radio program that cares about you and the most important part of your life, your health. I'm Mark Alyn. During the next hour, we're going to spend some time with the author of a new book called No More Vodka in Your Orange Juice. But we're going to start with kind of a very upbeat, positive story that can help change your life and impact your life and help even save your life. Our guest is Robin Wiener. She is the co-owner of Get Real Health. We'll find out about Get Real Health. Robin, I guess when you were in elementary school, you were told you were dumb and stupid and will never amount to anything. That had to have been horrific.
It was. It absolutely was. And, you know, being young, you're just hearing people say that about you. And back in those days, they just thought you, if you couldn't pronounce things or if you had trouble learning, that you were just dumb. Well, I was very lucky. I had a mother who didn't believe them.
In California, they just made you go into radio.
I guess that's what happens, yes.
Yeah, it happens. Can't pronounce, can't read, can't spell. Anyway, that's another story. But your mom really helped guide your life. She saved your life.
She really did. My mom and my brothers and sisters, my father. But my mom just recognized, she had 4 children, and she was a young mom, and when they said, oh, your daughter just isn't as smart as her brothers and sisters, and she looked at the school system and said, no, I think you aren't. And she said, she's my brightest, and you just don't know what you do with her. You don't know how to work with her. So she started doing some research, and she found a book that says, Why Can't Johnny Read? And she started to read that book, and she figured out what was wrong.
And you have dyslexia.
I have dyslexia and some learning disabilities. And so instead of putting me in a box and saying, she can't do anything, she encouraged me and tried a bunch of different things herself to see if she could get me further along.
What did you do to be able to read and get through all the material you had to through grade school, middle school, junior high, we used to call it, high school? Did you go to college? I
did go to college, and they said I never would.
Right.
The first thing she did, because I had a pretty terrible speech problem, she found a program I grew up in Connecticut, so at the University of Connecticut, and got me into a program there for speech. My parents were a young couple, didn't have much money, so she had to figure out ways to do things that weren't, too expensive. So she got me into a school program, at the university with students learning how to be speech pathologists. And she basically found that program and got me in there. And the other thing, which really helped a ton, not only on my speech, but also on my confidence level, is she got me into music and theater.
Oh, my goodness.
Because as you well know, it's all about the diction.
Absolutely.
And be able to pronounce, and to really pronounce it loudly and clearly out to the audience. So what she did, so I wouldn't feel weird about myself, she put all my brothers and sisters and I into theater, and we went and did theater every summer. And then through that,
the Von Trapp family.
The whole family.
Yeah, the Von Trapp family.
Yeah, exactly. It was just the Kinch family.
Yeah.
but she did it. And my mom was a first-string violinist, so she really understood what music could do for you. So, and it was a great way for me to build my confidence and get in there. This is back in the 70s, and people really did not know what to do with what I had. They just would put me into, there wasn't any classes, so they would just put me in with behavioral problems kids. And so I just pushed through and found ways to get around things.
They were better than the metal shop kids.
Yes.
That's where they put me because they had hot liquid metal. I was always the small guy. And they could, anyway, we won't go there.
No.
How did you take your disability and you turned your life around, and now you've founded a very successful health IT company, and you're back into health? Have you always been working in the health field?
No, I actually wasn't. So my career kind of went from actually retail, so went to college for, and then got into recruiting and HR, and I worked in a technology company. And when that technology kind of busted during the .com time,
right.
I ended up meeting up with two great partners, Mark Alyn and Jason Harmon, my two business partners, and we decided to go ahead and do something on our own, put our destiny into our own hands. So we started a technology company, and at that time, mostly professional services. But in 2007, we got involved with Microsoft and the Microsoft Health Vault. And what Health Vault is a database for all your own personal health care records. And what was interesting about that is they realized after Katrina how people really need to have an electronic copy of their records. And what happened is, during Katrina, you're in New Orleans.
Mm-hmm.
Not only did your house flood, but your doctor's office flood, and your hospital flooded. So now you're going into Dallas or Houston, and they're saying, well, you have cancer where you are in your therapy. And they had no clue, and there was no way to look it up. So Microsoft, through one of their engineers, Sean Nolan, came up with this idea of a health vault, where you could put all that information and log into it.
On the cloud.
On the cloud. And that way it doesn't matter where you were. And it's really just a database, and we started building applications on top of it to really expose that information and be able to actually empower the patient to take that information and do something with it. And really was exciting for us. When we started the company, we thought, wouldn't it be good? These guys were really good technologists, but wouldn't it be neat to actually do something that meant something in the world?
And
we kind of fell into this.
And at the same time, at least one of your other partners has a health issue and has turned that around so that he's giving back in his way.
Absolutely. He has diabetes. He's a type 1 diabetic. And he's been able to really get the word out to the diabetic community about using these kind of tools and be able to actually track what your blood sugars are through devices and connecting to our system, and actually see graphs of exactly what's going on. And along with that, he built an alert system. So if your sugar level goes out of range, an alert is sent to your family member and your doctor to let them know that you're in trouble. And that's in any chronic disease, but we really, launched it with diabetes. And that's where you're going to actually save somebody's life.
Right.
Because all of a sudden that information will go, and, they'll know where you are. And now with GPS locators, you can absolutely find that person when they're in trouble.
We've talked about personal health record management on the show in the past. There have been other companies who are doing it. But what makes yours unique?
So what makes ours a little unique, it's just not a website. It's a platform that has over 200 different widgets or little parts or Legos that you would per se. And you can build any kind of health application. But what makes it really work for people is that it's not just sitting by itself. It's just a personal health record. It connects into your hospitals, into your doctors, into your communities, your health exchanges.
Can I access it from my iPhone?
Yes, absolutely. We got to meet them where you live. Your iPhone, your Android, your Windows, any of them, your BlackBerry. Also,
I'm a Mac guy. I understand this is a Windows platform, but I'm a Mac guy, so I just, we got to...
I'm sitting next to my iPhone right now.
Okay, good deal.
Absolutely. It has to hit on all the
So all devices and making it mobile. Our guest is Robin Wiener. She is a co-owner of Get Real Health out of believe it or not, Rockville, Maryland. Yep. And she's in Boston right now. I think you're presenting, aren't you?
Actually, my partner, my vice president presented. We're going to be actually meeting with a couple of large hospital systems here in Boston. So it's an exciting moment. And what's happened now is the hospitals are now mandated with a new law coming out that's called Meaningful Use Stage 2. And what that does is mandate the hospitals to have to actually be able to transmit your medical information.
Right.
Transmit it. They have to be able to have the patient be able to download it, and the patient needs to be able to view it. And through our system, you're able to do that. So we're talking to many hospitals, and we're actually deploying it. So this is really important for your
Absolutely.
your audience to understand that they have a right now to get that information.
Yeah, a lot of times doctors will say, "Yeah, you can come over and they'll even charge you $1 a page."
Yep.
Which I find reprehensible,
Mm-hmm.
but it is better than attorneys because they charge $2 a page. I hope you're not married to an attorney. Our guest is Robin Wiener. We're talking about health records, about your health, about my health, and about having access to that because we, as the patient, need to know that. If you go to a doctor, I can see this right now. You go to a doctor and you give him, he does a bunch of tests, and you decide you don't agree with him or her, or you want to change to another doctor. Why go through all those tests again when you could simply just say, hey, look, we had all these tests done by an independent lab, and you can take a look on them online or on your iPhone or iPad. I just went to a doctor and they were doing everything on an iPad, including sending prescriptions to pharmacies. I found it fascinating. I'm going to ask you to hold on. We've got a break coming up. This is Late Night Health. We are talking about your personal health records and the fact that new legislation says hospitals need to make all your records, doctors need to make your records available easily to you. And we are talking with an entrepreneur who has taken the challenge and has turned your records into easily available information. Her name is Robin Wiener, and she is the co-owner of Get Real Health, based in Rockland, Maryland. Let's talk about security. I really don't know what somebody could do with my personal health records, okay? Other than finding out how old I am. And I'm like Jack Benny, I'm 39.
That's right.
Right? But,
of course.
Yes, of course. What about the security issue?
It's really important, and that's something everybody is concerned around the world on security. So it is held, all the information that we that's brought in is held a couple different places. One is with Health Vault as the data cloud, and that has gone through some very deep security protection. They've gone out to the top people in the industry and made sure that that is locked down as tight as possible. Any other information that we have come through, we actually are in what's called a high trust secured location, and we have gone through. It was a 6-month investigation and backups on backups to make sure that it can't be hacked. People cannot get into it. So your information is so important. Your health information is so important. So we have done everything we can to lock it down as tight as possible.
But do I really care that, Joe Smith knows that I'm taking, an antihistamine? I mean,
I don't. Some people do
and
get worried about that. I don't. It's what I am and who I am.
Right.
But people do get concerned, especially when you get into things like AIDS and cancer. But we all have to remember our insurance companies have all that information already, and that's where a lot of the concern is the insurance company. Now, with the new laws now, though, with the new healthcare laws, what was before considered an existing condition is now going to be not held up in law anymore. So before, you might have a problem getting your insurance if you had an existing condition. So people didn't want their insurance companies to know about it. With the new laws coming out, that is actually something that they can't discriminate you against for you. So I think that has opened up people's minds a little bit. That is not going to be as tough as it has been in the past.
And you said that people really can't hack into it, but they say that about,
we try to do everything we can to try to, stop it. But yeah.
It can happen. To me, it's not that big of a deal. I mean, I don't want them to have my credit card information, and I really don't know what they could do, and they blackmail me that I'm taking an antihistamine from an allergy or something. I don't want it out there, but it wouldn't be as bad as having my credit cards out there, right?
Yeah, and we got to think that we've been doing it. People are very funny about it. Is we have all our banking online.
Yeah, absolutely.
We've had it for years. And at first everybody was, oh my goodness gracious, right? We can't have that. But you know what? Now we're so used to paying our bills and doing everything online. But I gotta think you got to balance against worried about the security side, and we have tightened it as far as we can possibly tighten it. The other thing is, for the first time, you're in an emergency situation and you're in the ER, you can take out your phone and hand the phone, or your family can, hand the phone to that ER doctor, and that they can look at all the medicine.
I'm allergic to penicillin or whatever it might be.
Exactly, anything you're allergic to, what your last blood pressure was, all those kind of information. It will save lives, because if you're allergic to a drug, or if you're on some drugs that they need to know to understand, maybe you're on something that's making you bleed, things like that, if they can see that by just handing the phone to them, that might save your life. So you've got to balance it in your life of what that could mean for you.
The access, and especially I can see if, I travel a lot, so if I'm in Connecticut visiting you, for example, you grew up there, in Rockville, Maryland, excuse me, eating, Maryland stone crabs, or those are Florida stone crabs, but eating crabs, yeah, Maryland exactly. Crabs. Maryland crabs. There's a song, about that in a Broadway show. If there's, and you're away, and you have no access to your regular doctor, and you're having a heart attack, you're having some kind of episode, this would seem to me to be brilliant to be able to do. As we wrap up, is there a charge for this to the consumer?
The consumers don't. What we've seen is really the hospital systems, or the health exchanges, and et cetera, they pay for it. This is something they give to their patients, because, they want you, and the insurance company, everybody wants to say that the trend is now to keep you healthy. Before, they wanted you to come back and see them a lot. Well, now there's a new trend in healthcare. Instead of just getting you in and charging more, they're getting paid to actually keep you healthy. What a crazy thought.
What a crazy, we will see about that one.
Yeah,
listen, I really enjoyed talking with you, and congratulations on creating the system. I look forward to having my doctor show it to me soon as well.
So make sure you ask for your records.
Absolutely. Ask for your records. And if you would like information, you can just visit latenighthealth.com and look up Robin's name, and it'll take you right to her website. I'm Mark Alyn. We'll be back as we talk about addiction coming up here on Late Night Health.